Welcome to all our Scarsdale Health Plan members. I am recording this screencast today to provide a quick update on the Montefiore situation and talk about next steps. This presentation will include a recap of the Montefiore United Healthcare issue, an explanation of the plan experience you can expect now that Montefiore Health System providers are out of network, a brief description of appeals, a description of a network alternative and an interest survey that will be coming your way, and a brief outline of next steps. Okay, so here's where we are. As most of you know, or hopefully all of you know, Montefiore Health Systems, which includes a number of hospitals, facilities, and a great number of physicians in the Bronx, Westchester, and Hudson Valley area, is in a protracted contract negotiation with United Healthcare, and they have not reached agreement on a successor contract. United Healthcare matters to us, the Scarsdale Health Plan member, because they provide our in-network access to facilities and physicians. The contract between Montefiore Health System and United Healthcare ended on January 1st, 2021, so a few weeks ago. As a result, all Montefiore Health System providers and facilities are now out of network. Notably, for the local region, this includes White Plains Hospital and Scarsdale Medical. This is what we are doing in response to this. In addition to ongoing advocacy with UMR to try to influence this process as best we can, we are taking some immediate action. First of all, we're going to waive the $550 out-of-network deductible for Montefiore providers and facilities. So if you go to one of these providers or facilities, we will be working with UMR to waive the deductible. We will reinstate the $46 copay in lieu of 20% coinsurance, again, for these Montefiore providers only and facilities. However, this does not fully protect you because what we cannot do is protect you from balance billing. That is the difference between what our plan is set to pay a provider based on the usual reasonable and customary costs of such a service and what the doctor or provider charges you. I'll give some examples. So if you go to a Montefiore provider for, let's say, for an office visit, you will do what you've always done and show your UMR card or your Medicare card. The office will likely tell you the provider is out of network. For non-Medicare primary members, here's what this will mean. Either you will not have to pay any copay at the time of service, and you won't pay anything, or the office will request payment at the time of service. This is something they are allowed to do. In other words, you would be responsible for the entire cost of the service at that moment in time. If there is no payment made at the time of service, the provider will submit a claim to UMR. That claim will get processed on an out-of-network basis with the deductible waived, and you'll be responsible for a $46 copay plus 100% of any amount charged by the provider that exceeds UMR's payment to the provider based on what's deemed usual, reasonable, and customary. It's important to keep in mind that one of the reasons for this impasse in negotiations is that systems like Montefiore that provide a lot of services to Medicare and Medicaid primary patients often use upcharges on commercial patients to make up their costs. So it is very likely that you will get balance billed or charged more than what UMR or the Scarsdale Health Plan will pay. If you make payment at time of service, it'll be your responsibility to submit the claim to UMR. Probably. The provider may still do that. You can talk to them, but oftentimes it would be you who submits the claim. The same thing happens. You'll be responsible for a $46 copay plus 100% of any amount you paid the provider. UMR will reimburse you in this situation, but again, they'll only reimburse you to the usual reasonable and customary amount. If you are a Medicare primary individual, the same sort of steps will happen, but for Medicare members, there's no copay at the time of service. The provider will submit the claim to Medicare. Once that claim is processed, it'll move on to UMR, and UMR will process the claim out of network. So you'll be responsible for any costs that Medicare doesn't cover on an out-of-network basis, except the deductible will be waived. And of course, because these providers accept the Medicare assignment, there will be no balance billing. So they are prohibited from doing that. So there is significant protection here for Medicare members. Again, this is for a specific office visit. There are a variety of other types of care, emergency care, surgeries, other sorts of care that tend to be much more expensive and might have a much larger impact on you as a Scarsdale Health Plan member. Those situations are too numerous to review here, but they would function the same way. Obviously, with a potential larger hit to your pocket because of the experience. A word on appeals. As you know, the Scarsdale Health Plan has a multi-step appeal process. Given this situation, I think what we're going to ask you to do is that if you receive an explanation of benefits that results from a Montefiore Health System provider or facility that you intend to appeal, that you want to argue, we would ask that you please notify us first, and we will work with you to help you process that appeal and make the best decision possible. What we ask you to do is to either email or fax us, crossetti@scarsdaleschools.org, or at this fax number. Get to us either by email or fax the explanation of benefits, the EOB for the data service you intend to appeal, and we will respond directly to you to advise you on how to proceed. Now, I'm introducing the possibility today of an alternative that would bring the Montefiore providers and facilities into network. This is new information. I ask you that you pay close attention to this. We are exploring carving out the optional use of Empire Blue Cross Blue Shield network to restore the Montefiore Health System providers as in-network providers. This would be effective between the months of March and June of this year only. The way this would work is that you would be given the option to elect to drop out of UMR's United Healthcare Choice Plus network and to drop out of POMCO Select network and join Empire Blue Cross Blue Shield. If you were to do this, you would no longer use UMR for your medical insurance. You would use the Blue Cross Blue Shield providers, and they would be your new network for all medical. Not just Montefiore medical, but all medical. But what we know about this network is the Montefiore hospitals, facilities, and providers are in network with Empire Blue Cross Blue Shield. We would be using their PPO network. There would be no change to your prescription plan, so you would keep your UMR card that has your prescription information on it, or if you're Medicare primary, your Benestar card. And importantly, if you were to do this, there is absolutely no change to the benefit. The same things are covered, the same copays, and so forth. We dictate the benefit, the Scarsdale Health Plan. That benefit would be honored through the Empire Blue Cross Blue Shield network. So this would involve a three-part process, making this change. First, we are developing and we'll send out an interest survey to gauge how many people might be willing to make such a change or are interested in such a change. If there are enough people, we will engage in a very brief open enrollment period where you will tell us you wish to do this, and we will enroll you in Blue Cross Blue Shield and unenroll you in UMR's medical. Then the third step would be start of coverage with a new card and network. This would end June 30th. So, what are the next steps? Well, first, we would ask you to complete the survey. This will be coming out via email. We need to reach a decision point. Our point that we determined that would cause us to offer this would be if 100 or more members are interested in coverage through Blue Cross Blue Shield in lieu of UMR. We would then make communication with you all about the decision and run our open enrollment period. And we would shoot for ideally a March 1st, but possibly a March 15th start, depending on how quickly we could get this up and running. So this would cover March, April, May, and June, and restore Montefiore for that period of time as in-network. So the survey that's coming out is designed to ask questions to help you make a decision, and we would provide a recommendation as to whether it makes sense or not to make this change individually based on your responses. Simultaneous to this, we are generating a request for proposals for a new plan operator. Right now it's UMR, which is our third-party administrator. So we are developing an RFP, and we will solicit bids for running our health plan and providing a provider network. And we intend to respond to that and make a decision in time for a July 1st, 2021 start. Blue Cross Blue Shield could be a player in that, as could UMR and other networks and third-party administrators of our health plan. Obviously, we will need to provide more communication as that approaches. All right, so that provides a quick update and summary. I hope you were able to get some of your questions answered. The survey will be forthcoming, and we'll have opportunities to address questions thereafter. Thank you.